My name is Dr. Laura L. Dugan, and I'm the head of geriatrics here at UCSD.
My name is Ed Handler. I am chairman and CEO of the Bronx Project, Inc.
There are probably about 20 million Americans actually suffering from Alzheimer's disease, Parkinson's disease, and Lou Gehrig's disease that currently have no effective treatments. Parkinson's patients are placed on dopamine replacement therapy, and that can for a time allow them to walk more normally. One of the things that's been very exciting and perhaps surprising to us is that the antioxidant compound that we had been studying, C3, seems to be effective in animal models of all of these diseases. We're actually imaging through the skin and skull of a live mouse into the brain.
It's pretty heady stuff to contemplate being able to rescue tens of millions of people worldwide from a dreadful outcome and a horrific life existence, and for their family and loved ones that are burdened with this as well.
C3, it turns out, is one of the most potent antioxidant compounds that I've ever studied. It's approximately 10,000 times more potent than vitamin E, which is a classic antioxidant that we all take and has been used in many clinical studies. So in addition to being a potent antioxidant, because it isn't converted to anything else, it doesn't have the worry of having toxicities that you often get when you metabolize a drug.
The body doesn't need to make natural antibodies against it. We've seen in long-term tests the ability for primates to take it for years.
It is essentially a soccer ball with 3 small groups attached to it to make it water soluble. But to our surprise, and this is probably why it's so effective, the chemistry turns out to make it a catalytic compound, and that means that it's not metabolized and it doesn't produce toxic byproducts itself, and then it's cleared from the body intact. To get the amount of C3 we've been giving in our monkey studies, for example, you'd have to probably drink about 100 gallons of pomegranate juice per day to get the same amount of antioxidant effect. No, it's a new technique that we're actually writing up for submission to a journal, and it's never been done before. So it was collaboration between our group and radiology to develop a new approach to this. We noticed that when we were treating animals long term with this compound that we weren't picking up any side effects, and in fact the animals that were receiving C3 for what was equivalent to 2/3 of their lifespan actually were more healthy, had retained cognitive performance. For example, they had better learning and memory, and their strength was improved, and they actually lived about 12% longer than the animals that weren't receiving C3. And we took that to mean that in fact we were not seeing any important or major or any toxic effects. It's not generally normal to see a lack of any toxic effects with a drug. We believe that we have been lucky because these compounds aren't, or C3 is not metabolized. And we believe that that's really key to the lack of detrimental effects from C3. Among the milestones we've achieved with our studies have been to fairly carefully characterize the toxicity of these compounds, as we discussed. We also have a lot of information now about how they are distributed throughout the body, and we've now tested them in roughly 8 to 9 different animal models of brain disease and injury.
And what are we seeing here, Laura?
So we're seeing a brain slice that's triple labeled with red is a mitochondrial protein. The recent work in primates, non-human primates, has shown that even in the most accepted animal model for translation into humans, we're also seeing efficacy and lack of toxicity.
We would like to anticipate the repeat of our previous work in primates to be completed in perhaps 9 months, and at that point, with all her accumulated work, to go to the Food and Drug Administration. I will be thrilled to see the Bronx Project, Inc. carry this work forward, a big step towards enabling people to live longer and survive these diseases.